our good friend, Dr. Carlos Rodriguez, the Evara Health Injury Report. Hello, Doc. How are you?
I'm doing good. And I hope the sound and signal, everything is good. I'm not at my usual place. We're at the Coliseum celebrating Evara Health.
Oh, perfect.
We're using some new internet and a new quiet spot. So hopefully it all sounds okay.
No, it's perfect. It's perfect, Doc. And everybody's so excited. We had a couple people. Look, Doc, hashtag Doc knows. Everybody was chiming in earlier today. They couldn't wait for this segment. So thank you so much for your time. Let's get right into it, Doc. I just mentioned George Springer. Those injuries are tough, man, because when you take a swing, and I've been there, and sometimes it's a foul ball, sometimes it's a foul tip, sometimes it's a swing and miss, and you just know it. And you there's nothing you can really do. Is there any way we see George Springer for Game 6 or Game 7?
I highly doubt it. I mean, if you've experienced this, it's basically an oblique strain. Basically, if you see him swing, as soon as he finishes a swing, he winces, grabs down at that lower back right side. He's unable to continue. So the oblique strains are very common when you do rotations, like when you're batting. Recovery typically is 3 to 6 weeks. So we're talking here days. So on average, professional athlete coming back, we're looking at about 3 weeks. Best scenario is 4 to 5 weeks.
Could he gut through one at bat, Doc? Could he manage one at bat?
I mean, he could stand there. He may do the best trying to swing a bat, but it's just painful. I mean, and the reason it happens is, I mean, that's your trailing side, right? So that he's left-handed. So that's the part of your body that's trying to stop your motion as you're swinging around.
Right.
So your leading side is starting the rotation. Your backside is trying to stop it as you reach kind of the whole swing. So the muscle's being stretched out as it's trying to contract. Wow. So that's what we call an eccentric contraction, and that's where tears happen. So it's very painful if he's trying to swing a bat and that muscle fires up. It's just going to hurt. So it's not going to be very effective taking on a bat.
Doc, talk to me about oblique injuries too, because I just, they've been so prevalent the last decade or so. But when I was a kid growing up, I mean, I was always looking at the injury list. I don't really ever remember somebody talking about an oblique injury. Was it something else more than a decade ago? Was it something because now there's, guys are in better shape so that they're susceptible to an injury like this? Or is this something that maybe just I didn't see and I was oblivious to it? Talk to me about oblique injuries and the prevalence of them.
Yeah, I think the injuries have been there. We may have called them abdominal strains. We may have called them a back strain. As we understood a little more the mechanics, we kind of changed a little bit of the terms to an oblique strain. So, I mean, hockey, I see you're right there at the Lightning Arena, and hockey can happen too because it's any rotational type motion. So taking a hockey shot, a swing at a bat. Again, a lot of athletes these days are bigger, stronger, faster. They're trying to do big swings, big at bats. So you tend to have these injuries. I don't think they're more prevalent. I think we're identifying them a little bit easier, and we're being a little more careful when we see them because we know they can be long-term injuries. They can take time to heal. You don't want to rush your way into the motions again because now you're prolonging recovery. So the fact that 3 to 4 weeks is usually on average what most athletes take to recover from this, that's pretty short-term. I mean, not when you're looking at a World Series we're talking about just days.
Right.
But it happens. They're quite prevalent, especially in baseball.
And I'm here at Benchmark International Arena. You coming to the game tonight?
I am. I'll be there.
Oh, going to be great. They're honoring Nikita Kucherov for his 1,000th point. So make sure you get here early, Doc. And we got to see Max Crozier. We spoke about his injury. He was on the ice today in a regular jersey. So Coach Cooper said that he will be back, it looks like, during the road trip in the next week or so, which is good. Nick Pohl, unfortunately, still in a red no-contact jersey. Right. You and I spoke about it a couple of weeks ago with that wrist tear. When do you think? I think we're getting close, right? They said November, so obviously November is going to be on Saturday. Probably the next couple of weeks, right? 2 weeks, you think, with Nick Pohl coming back?
I think so. Maybe a couple of weeks. We talked about this. I mean, we were trying to take a little bit of a guess as to what injury he could have had on the wrist. I'm thinking it's what we call a TFCC, or triangular fibrocartilage complex injury, which is a ligamentous injury on the both side of your wrist, kind of towards the pinky side. And again, if he had surgery, we talked about usually 6 weeks recovery time after surgery to 8 weeks. He had the surgery early on before the season started. So they were targeting November. If everything is going according to plan, I think probably in a couple of weeks, he should be in the lineup helping the Lightning out.
Is that something that you have to worry about guys slashing you in that spot, or is it more of the wrist movement of shooting the puck?
I think it's more the wrister. It's more the wrister shot. I mean, when you get slapped more on the radial side or the big thumb side here of the wrist, because that's where you get struck. You don't really get struck on the downside. But that rotational motion that you have when you're shooting, especially a wrister, is usually when the injury is going to be. I mean, you're holding a stick that's creating a little bit more momentum and force and torque on your wrist.
Doc, what is some of the more prevalent injuries in hockey? Because a lot of it, and we talk about ACLs, we talk about obliques, we talk about a lot of different things. And we've seen a lot more non-contact injuries, I think, in football. What about hockey? Where do you see the majority of the injuries coming on the ice?
Yeah. Hockey, I think, are mostly typically contact injuries, or maybe something happens on the ice, like we saw with Recher, where the blade just gets stuck on the ice. But they usually happen in contact. The blade could be on the ice, and if the foot's planted, you get hit, something gets twisted, whether it's the ankle or the knee, or usually we see them when someone gets boarded. And then they may suffer a knee injury or may suffer a head injury or a back injury as they get boarded during the game. Non-contact injuries are not as prevalent in hockey as they are in football.
What about kids? What about youth hockey?
Youth hockey, we see concussions are quite prevalent in youth hockey. So a lot of impact contact. I mean, you're not supposed to be boarding and checking and hitting into the boards in youth hockey, but impact does happen. Other than that, wrist, just from getting slashed or getting hit or falling. You fall and you don't put your hands out, and you're going to hit the ice, and then you're going to have some wrist injuries with that. But it's not common to see ACL, MCL injuries. Right. Ankle sprains are not very common, again, unless you actually get hit or your foot is planted. But you also have the boot holding the foot in place, so those are not as common.
Yeah, I got a pretty bad concussion playing hockey when I was about 14. Head-on-head contact with a friend of mine. Didn't see each other. It was not good. One of the bad injuries that we saw from over the weekend was Cam Skattebo from the Giants. I mean, man, unbelievable. And you see him down, and you kind of know you saw his foot on the wrong way. And I saw something that you brought up about you got to make sure that you get to him quick. What can you tell us about his injury and how they were able to take care of him there in Philly?
Yeah, so that's a pretty devastating injury. Again, this is not only was it a dislocation, but a fracture, and in his case, also an open fracture. So you don't really, if you got to take a quick look at the video or trying to find a video where you see all the details. They blurred a lot of this stuff out, but his bone's actually sticking in his sock. When the foot's turned sideways, the bones actually come through the skin and it's protruding into the sock. So the injury, the mechanism, pretty devastating. His foot is planted and gets what we call dorsiflex. So his toes are pointing way up as the foot gets then rolled over by the defensive player. So when your foot is pointed up like that with your knee over your toes, your ankle is locked. So your ankle doesn't have any give at that point. If you point your toes down, you can wheel your ankle side to side. You point your toes all the way up towards your knee. Your ankle doesn't have a lot of motion. So now we have basically a mortise that is locked up. And now on top of that gets hit and gets twisted. So something's got to give. So in his case, the fibula, the little bone, gave up and it snapped. And then it snapped in such a way that actually came and poked right through the skin. Along with that, because he had what we call an eversion injury, meaning the foot turned outwards, the deltoid ligament, which is the inside ligament of the ankle, got destroyed and gets torn up. So you have to, one, reduce the fracture. So immediately what you do is you go right there. You have to reduce the fracture. So you grab the heel, grab the foot, put traction on it, get it back to the right spot. Then you got to put them in that pneumatic boot to, one, prevent bleeding, provide stabilization until you transport them. But you got to do an immediate reduction because you worry about neurovascular flow, whether the vessels and the nerves are intact or there's no flow. So you got to reduce it as quickly as you can. In his case, you also got to worry about infection now. because the bone came out through the skin. So I'm pretty sure they probably put some betadine or some anti-infective on it while they splinted it. But now you also got to monitor for infection on the bone as well as the skin. He had a successful procedure from what I read, and everything went well during the surgery. But you got to do some really watchful waiting on infections. I'm pretty sure they put him on some heavy doses of antibiotics to prevent any sort of infection. He should recover well. Now he's going to be out the rest of the season. He should be back next season. Recovery time is typically 8 to 9 months. Kind of the Chris Godwin type injury, except Chris didn't have an open fracture. But we're looking at end of season, and he should come back.
Does he have to worry about the same things that Chris had to worry about as far as the issues on top and the bottom of the hardware there?
It can be because there's going to be some hardware there. That fibula is going to be fixed with some plate and screws. Plus, you're also going to have some fixing to do on that deltoid ligament. And that's usually more soft tissue type fixing. But there's going to be some hardware there. And you have to have the same worries that Chris, and maybe hopefully not the same issues Chris is having with his fibula.
Is there anything else that Chris could do? I mean, we've had this conversation is there any way to get to the point where the bone heals all the way, Doc, where you take the hardware out completely? Is there any type of medicine that can strengthen the bone? I mean, because not a lot of people, you're really one of the only people here in the Tampa Bay area that is really discussing the real issue here with Chris Godwin. And the more and more I think about it, Doc, I'm concerned. Forget about him returning as a football player, but just him this season for the Buccaneers, but him as a football player, because, this is his livelihood. So is there any, what is the next step if it doesn't heal properly?
Yeah. So, I mean, if it's a stress injury, it will heal up. You can remove hardware. Once fractures are healed up, you can go in and remove hardware because the bone is healed. But then you got to give time for the bony areas where there were screws to fill up and for the bone to heal up. That would be something that would be done off season. Take the hardware out once the bone is sealed up, especially if the hardware is causing any sort of issues or any sort of trouble. As far as any supplements you can take, you can always take calcium, vitamin D to supplement bone mineralization and bone healing. He's a very healthy individual, so I doubt that there's any vitamin D or calcium deficiencies that would be affecting the healing process of the bone. Taking extra supplements doesn't hurt. It may actually improve a little bit of the healing process, but certainly having some consideration to remove the hardware if it continues to be an issue later on is something that can be done.
I want to ask you about Lamar Jackson. Obviously, there was kind of a funky thing last week where people thought there was some issue with the injury report, but man, Baltimore has really struggled this season without their MVP. What can you tell us about Lamar Jackson? You think he'll be back this weekend for the Ravens?
He should be. I expect him to recover. Have had enough time to recover from the injury, so I do expect him to be there this weekend. I haven't read in the reports whether he's been practicing or not.
Right.
But I expect him, if he's been having some practices, to be able to be there for game time.
It's got to be tougher with these guys at the quarterback position that use their legs a lot, right, Doc? I mean, it's one thing if you're just not as mobile and you're an old school Tom Brady type, stay in the pocket. But, man, right. These injuries, I mean, it's a great thing to be able to have a quarterback like that can run. But you also leave yourself open and susceptible to a lot more injuries, don't you?
You do. I mean, especially the impacts, the hits. I mean, hopefully not a big injury like Skattebo had. But you're opening yourself to more injuries because now you're a target. Now you can't be hit in the pocket, but usually you're protected there as much more frequently than if you're out running. And now you become, and quarterbacks, certainly once they start running, they become a target. The linebackers and the safeties are looking forward to putting a big hit on the quarterback.
How about Michael Penix Jr.? Obviously, we keep a close eye on him because he's a Tampa kid. He's the Atlanta Falcons quarterback. We see him in the division. Didn't play last week. Kirk Cousins went in there, and it was ugly. What are the chances that we see him back with Atlanta?
I think it's a pretty good chance. What was reported was he had a knee bruise and some bone bruising around the knee. Looking at the video, it looks like it was basically the hip area of the tackler. The 49ers hit his patella, his kneecap, and usually then the kneecap will hit the femur, which is the bone right behind it, and the patella will bruise. Painful because your patella now is hurting and is swollen, and there's swelling surrounding the patella. Most mild bruises, usually a couple of weeks is enough for the pain to subside and for motion to resume. Sometimes they can be quite complicated. If you follow these on MRIs or with MRI findings can be there for many months after the injury, but usually what you judge it by is by pain. And with a mild injury, usually 2 to 3 weeks. He was out 1 week, so this is the second week. So I expect him that he should be fine. At least give it a go during practices. And if he's feeling well, I expect him to be playing the Patriots this weekend.
Young quarterback to an old quarterback, and Joe Flacco. It's been kind of crazy to see a guy in his 40s get another opportunity with Cincinnati and doing a good job. I heard yesterday that he was 50-50. I know it's not. We talk about the recovery. We spoke about this last week with Emeka Egbuka of these young guys and their ability to recover. You don't recover as well, I can tell you, from being in my 40s now. But what do we think about Joe Flacco?
So Joe Flacco has an AC joint sprain or AC joint separation on his throwing arm. So that's a bigger deal because every time he's got to throw, he's got to raise his arm up. So that joint's going to become very painful. Injured against the Jets. He's very questionable about for this weekend. A low-grade injury, what we call a grade 1 or grade 2 injury, is treated conservatively. Most people regain function in 2 to 4 weeks. So I expect him a couple of weeks, 3 weeks, he should be fine. The return to play is really guided by pain, motion, and strength. Again, it's his throwing arm. So you got to make sure that he's able to raise his arm up, have the strength to be able to throw the football without any discomfort. Average time lost for most guys in football that have a grade 1 or 2 sprain is about 10 to 12 days. So he should be right on track to come back down to the next game. Grade 3 injuries, which I doubt he has, because grade 3 injuries in professional athletes are usually treated surgically. In non-professional athletes, we may do conservative management. It takes longer. Grades 4, 5, and 6 usually require surgery. So in his case, I'm thinking a grade 1 or 2. That's why they didn't jump into any surgical type of management. So 10, 12 days, he should be fine.
I didn't put this in our list, but I wanted to ask you about Carson Wentz. I don't know if you saw this. He tore his labrum and fractured his shoulder socket October 5th, kept playing the next couple of weeks. It's in his left shoulder, but talk through us, because this is, Baker Mayfield had an injury to his left shoulder when he was in Cleveland. And some people will say, they'll be okay because they throw with their other shoulder. But Doc, I don't know if that's necessarily the right way to look at it, is it, man? Because even though it's not your throwing shoulder, I mean, you still have a lot to do with that non-throwing shoulder if you're a quarterback in the National Football League.
Yeah, I mean, the throwing motion is not just your arm that throws a ball. It's everything from your feet, grounding yourself, all the way through your torso, and even the lead shoulder has to have a motion in order for you to be able to have a strong throw. Now, can you throw up a ball without having a strong shoulder on your opposite arm? Yeah, but the throw, I don't think it's going to be as effective or as strong. So a labral injury, we talked about the labrum, I think, a couple of weeks ago, is basically the bumper guard that holds the shoulder in place. It's basically the ball sitting on that socket, or basically a plate. So the labrum is kind of that bumper guard. So that's usually when it tears, it has to be fixed surgically because it doesn't have any really great blood flow to it. It's a piece of cartilage. So it has to be tacked down or stapled back down or sutured back down onto the bone. Along with that, he did have a fracture on the plate. So the glenoid, which is the plate, also had a fracture, which probably was related to the labral tear. So that you can watch it. If there's no displacement, the labrum is going to get fixed. So he's looking at surgery, arthroscopic surgery to fix it. And usually that's about a 3 to 4 month recovery time from that.
Doc, what's been the latest on arm injuries for pitchers and for quarterbacks? As far as, we talk about Tommy John surgery and how people are looking for multiple ways to be able to operate on their elbow. Is there any late news? Because you figure a lot of people are looking into this because baseball or injuries, especially in baseball, to the pitcher's arms are so prevalent. What's the latest on what we're learning about these injuries and proper prevention? So every single year, we're not seeing Garrett Cole and all these different pitchers in the league, out for, a whole year because of an injury.
Overuse is the biggest issue when we look at elbow injuries, especially ligament injuries like the pitcher's medial collateral ligament, so the inside elbow ligament. Overuse, what happens is every time you pitch, every time you're doing throwings, little micro injuries will happen to the ligament, and those micro injuries need to heal over the course of time. And that's why you have usually a 4 or 5 pitcher rotation, because you got to allow the pitcher time to recover. Now, in between outings, they'll have mount practice and some pitching time. But when at the game, you want them to be 100% recover from the prior outing. So overuse is the leading cause of injuries when it comes to Tommy John. There's really no big research regarding muscle mass or muscle injuries. The guys that have bigger muscle mass. Motion can also impact, but most of these guys have great pitching coaches that are looking at the motion, or looking at the slot, or looking at the arm follow through. So when I look at kids having little league elbow, and you coach some youth baseball, it's usually a mechanical thing that leads to the injuries, as well as the overthrowing and the over preparation for the games. In professional athletes, it's really more, I think, an overuse type injury, because the mechanics have been polished. In kids, we have to still polish some of the mechanics to prevent them from getting hurt.
What's your belief on pitch counts for kids? Because I try to keep mine down. I know it's not the end all be all, and sometimes I feel like different pitches, all 5. One kid could throw 5 pitches and look nice and loose, and the other could be very 5 high labor, high intensive. And then, because there was a horror story I heard a couple of weeks ago where a kid threw 53 pitches on Saturday and then threw another 80 on Sunday for 133 pitches in 2 days. And it turned my stomach. What's the most important thing as far as pitch counts? Do we know, is there kind of a set rule that if you know off the top of your head, or is it just something that you have to monitor? And also, what should kids be doing after they pitch?
So pitch counts are very important. I mean, I'm a strong believer in pitch counts, and not only me, but I mean, in general, the American Association of Sports Medicine has come out with pitch counts and recommendations for pitch counts. So I don't have them right, the numbers out of the top of my head. It depends on the age of the kid, is what you want to do as far as throws, and then as far as rest days after throwing. So that will prevent a lot of injuries. Literally, we talked about the fact that in kids, the ligament is not the issue, it's the bone, especially kids where the growth plates are still present. The growth plate is the weakest link, so the growth plate will start moving as the ligament is tugging on it. So the prevention of that is monitoring the throwing, monitoring for symptoms, and reducing the amount of throwing. So, I mean, a professional player does not throw that many pitches. They won't go back to back. I mean, even in the game, they look at 100 pitches, and usually they're pulling them out no matter how well they're doing in the game. So why would you subject a child who's not even getting paid, and you could actually hurt their potential to play at any higher level in the future? Why would you put the child through that? So it's absolutely important to monitor the pitch counts, give the kids rest. And not only that, I mean, and you, as you coach baseball, your pitcher is probably one of your best players. So he's usually the shortstop, and if not, he's the catcher. So you got to be mindful that it's not just that, oh, he pitched 53 pitches today, but tomorrow he's going to play catcher. Well, he's throwing the ball back to the mound just as many times as he's receiving it. So you got to be mindful of that. So it's putting them also in a position, if they're going to play the next day, in a position where the amount of throws is minimal, so you still minimize the amount of stress that there is on that elbow.
Yeah, I've always sat my guys before and after they pitched or catched, and really try to sit as much as possible if you're a pitcher or a catcher. Well, I know when I was coaching in high school, you saw so many kids after they pitched, they put the ice on their arm. You don't see that really anymore. You see guys more running after the games. They're talking about the lactic acid buildup. After a kid pitches, whether he's 12, 13, like one of my teams, or a high school kid, what would you suggest day of, after a kid pitches, to get them in a position where they start their recovery process the correct way? Ice, running, something else?
So, I mean, ice is really needed if you have an injury, or if you have inflammation, or if you have swelling. So just icing your elbow just because you had a pitching outing, I mean, as you said, you don't see that anymore. If anything, what you want to do is work on stretching. Now your body's warmed up. So I'm a strong believer that after you've played, you need to spend 15, 20 minutes stretching, cooling down, working your muscles, working your joints, because that's the prime time where your body has now, it's all warmed up, it's all nice and loose. We see a lot of people stretch and warm up before they play, then they play, and then they're done. So it should be a warm up, then play, then stretch. That should be the appropriate way of doing it. So for a kid to recover from a pitching outing, unless they have pain or swelling, there's really no need to start icing. Good nutritional balance, good meal after you have a good strong outing and a good game, and then rest. And during that rest period, you can still do some exercises, you can still do some strengthening, you can still do some stretching, just to continue the rehabilitation and recovery process. Your body's going to heal up, but you just got to give it time to heal up and not have another pitching outing or another stressful event on top of that prior one, because then that's going to be cumulative. And eventually the body's going to break down.
So the bands, like a lot of guys are using the band work now. So I'm just trying to incorporate something to my pitchers. So after a guy pitches for me, if he runs a little bit, stretches a little bit, and gets on the bands, that's probably some of the best thing they can do.
Absolutely. You hit it right on. You're doing the right stuff for your kids.
Good. Thank goodness, man. Because when I see other people do it, it mortifies me, man. I don't know what to do. You know what I mean? Because you can't be at every field, right? And then when you see it and your heart just drops into your stomach, it's just absolutely it's a failure.
And it's important. And it's important for you to bring that message to your parents, right? Because as a parent, they're looking at the kid and go, "Oh, my kid is great at pitching, and he could." And they're thinking now he could go to college, get a scholarship. Oh, maybe he can go pro. Well, you got to think about the kid is an 11-year-old is pitching to 11-year-olds.
Yeah,
who don't have the hand-eye coordination. As your kid gets older and is 17, 18, and is pitching to now kids of that same age group who may hit better, who may bat better, their outings may not be as good.
Right.
So you don't really want to get in the way of, one, the fun, but also the development of your child. And we talked about that you should let your child play multiple sports, because that translates into better skills into your primary sport. But also you got to let your child recover, and don't put so much pressure on them that, oh, you're so good that you're going to become the next Shohei Ohtani. Those are once in a lifetime opportunities. And I remember when I did a little bit of work with the Rays, one of the athletic trainers used to always say, one of the things that I tell parents is, look at how many pitchers that pitch in the Little League World Series actually made it as major league pitchers.
Yeah.
And there's
very
only a
small
couple.
Number. Very small number.
It's very small number. So even at that level where you have a kid pitching in the Little League World Series, does that mean they're going to be a professional baseball pitcher? No.
Yeah. Great point, Doc. As always, the Evara Health Injury Report with our good friend, Dr. Carlos Rodriguez. He'll be in the building tonight here at Benchmark International Arena celebrating Nikita Kucherov and our Tampa Bay Lightning. Doc, always a pleasure, my friend. Thank you so much. I'll see you tomorrow. I got an appointment with you tomorrow, so I'll see you tomorrow morning.
Sounds good.
See if we can get me back on the field so I can throw a little bit. But you are the best. Thank you so much. Enjoy the game tonight. And, we'll talk to you again next week. Thank you.
Sounds good. Thank you.
The man.